Most people are familiar with breast, lung, colon cancers because of their frequency and national awareness and education. But head and neck cancer cases are on the rise. Toro family medicine physician Dr. Meredith Maxwell joins us to explain more about that. Good morning, Doc. So head and neck cancers they're a group of different types of diseases, but what can we tell about what they have in common, if you will?
They are. It's usually cancer of the mouth, nose, the sinuses, the throat, the lymph nodes, even the salivary glands. And it usually happens in an older individual, about 50 or older, and they're twice as common in men as in women. It's kind of concerning, some of the symptoms that you may have, because they could be like the common cold or an upper respiratory tract infection, but the difference is that it's persisting. So like trouble swallowing, a sore throat that doesn't go away, a sore that doesn't heal, hoarseness or voice changes. Like if any of those are persistent, please bring it up to your primary care doc.
So is there any theory as to why they are more common in men?
You know, tobacco can be a big factor in it, and so can alcohol. Eating a healthy diet is a big player. And gum and tooth disease. So, whether or not men are more prone to do those things might have something to do with it. And there might be some kind of genetic component that is more prone in men than in women that we don't really know about. But it's usually, like, you can't change your age or your sex, unfortunately, to avoid this. But you can change, if you're dipping or you're smoking or you're doing a pipe every once in a while, that can really raise your risk factor. Limit your alcohol, because that drinking heavily and smoking can increase your risk exponentially. And then, eating a healthy diet and getting regular dental visits, because gum disease, tooth loss, irritation of the gum and cheeks, and dentures that don't fit well can also play a role in some of these cancers. So you can change a couple of your risk factors, not all, but most.
How are these diagnosed then, generally?
So usually a patient comes in and is like, hey doc, I have this sore throat that just won't go away. And then the PCP kind of looks at it and they're like, oh yeah, that doesn't look quite right. Let's get you to the ENT or the head and neck surgeon. And that's pretty much how I've seen things been diagnosed.
One thing I didn't plan, let me interrupt you for just 1 second
Sure.
in the time we have available, forgive me. We do colon checks, for example. Is it a good idea to go to, to get a scope down your throat if you're just an average healthy person of 55 years old? Is that something you should be talking to a doctor about?
No, not quite yet. The risk-benefit ratio is not there, but during your annual, that is a really important time. Even if you're not having problems, for that full physical to be done so that your PCP can make sure that everything looks good. Again, another reason why your annual exam is really important.
Interesting, so that somebody is there to look at you and maybe the doctor noticed some changes in you if he's...
Exactly, and pull kind of some of those symptoms from you too.
Interesting. All right, as always, thank you so much, Dr. Meredith Maxwell.
You're welcome.
All right, 7:17, here's Shelby.